Good morning. Today is Tuesday, August the 19th, 2025. I'm Eric Feaster, Southern Maryland Regional Office Professional Development Coordinator for Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the Coordination of Community Services. We would like to use if you would like to use closed captioning, you can read what is being said. Click the closed captioning button at the bottom of your screen. Today's presentation is available in the handout section. Click where you see the paperclip to download the presentation. All attendees are currently in listen-only mode and your mics and cameras are turned off. This webinar is being recorded and will be uploaded to the DDA's CCS YouTube playlist and the DDA website. Today's PowerPoint will be available for you to download from the materials section. If you're listening by phone, please contact us to have the presentation emailed to you. And now I would like to introduce Nicolette Paparodamus, DDA's Director of Coordination of Community Services. Good morning, Nicolette.
Good morning, everybody. I hope you are all well. Thank you for attending today. There was a little change in our agenda. As you see, we're going to be moving the PCP micro training to next month due to all of the urgent waiver changes and the critical EDD issues. We wanted to touch on all of those things today to best support you in all of these updates and inform you on them. Today, we're going to start with Liberty Healthcare. We're going to be talking about the National Core Indicator Survey with service planning and what that means for you as CCSs. Then we'll be going into the DDA-operated Medicaid waiver amendment updates, waiver applications, and redetermination updates. And then we're going to talk about coordination of community supports training and some of those LTSS Maryland updates as well. And we will be closing with questions that you may have. Of course, feel free to put them in the chat so you don't lose them. But we will be asking you some questions during our presentation as well. So feel free to raise your hand if you need to be unmuted, or let us know to unmute you if that's not available for you at that time. So without further ado, we can go to the next slide. We will start with Christina Dixon from our Liberty Healthcare, and she will go over those National Core Indicator Survey results around person-centered planning. Christina, thank you for joining us today and for the presentation. If we could go to the next slide, please.
Good morning, everyone, and thank you for having Liberty on your call this morning. We are excited to share a little bit of data from participants with you. So many of you know, but I'll give a quick recap. People receiving services in Maryland do participate in the National Core Indicators Survey, and they give responses that tell us about satisfaction with services. Some questions in the survey ask about satisfaction with things that coordinators of community services help them with. For example, creating their person-centered plan, goals, and monitoring. And so we want to make sure that we're sharing what people are saying about the services that you provide. So today we have a few things to share with you about what participants said about their person-centered plan that you'll see on this slide. So you'll note that almost all participants said that their coordinator of community service made sure that they were at their meeting, or that they could at least be at their meeting even if they chose not to be. Very, very high, almost 100% of participants reporting that. And then additionally, almost 80% of people told us that they helped to make their plan. These two indicators show that coordinators of community services are very skilled with these two person-centered planning activities. People are often feeling that their coordinator of community services efforts are working to include them in making their plan. And we should celebrate the good work that you all are doing with people. Next slide, please. And then there are two more pieces of information that we wanted to share with you today that participants told us about during their surveys. So participants shared that there are additional goals that are important to them, like having a job or learning to do things on their own. And sometimes goals don't make it into a person's plan. We want to know why those goals aren't making it into people's plans as often. So it's important for us to check a few things. For example, we want to make sure that Maryland's rules don't stop important goals from making it into a person's plan. We also want to check to see if coordinators of community service are talking to people about employment, independence, and other important topics. And we should check to see if coordinators of community services are helping people know about all the options when they're selecting goals for their plan and even how they might be able to achieve those goals. It's important for people to know there are lots of ways to get help with goals. Doesn't just have to be paid services. So if there is a goal that they want to work towards, they could have paid services or family and friends or other community resources that are supporting those. And all of those options can be included in a person's plan. So we do have more information in the future that we'll share with you, but hope that you enjoyed just a little bit of the participant responses from the National Core Indicators Survey today. Thank you.
Thank you, Christina. Does anybody have any questions or comments for Christina now that she's here? And I want to add to this, fabulous work. Take a look at the National Core Indicator Survey. They are posted publicly. It's very interesting, and I think it'll really help with a lot of the work that you're doing, analyzing what's going well, what could be improved on. And with these, we will be utilizing them at our next PCP micro training session and talking about this in general, right? How to write that in the plan, connecting it with the services, utilizing those tools. So looking forward to sharing that information with you all at our next meeting with my colleague Stephanie Jones. If we could go to the next slide, please. I don't see any questions. And Christina, thank you so much. All right. So with this slide, Rhonda Workman is not here. She'll be joining us a little late, but she'll be presenting on some of these elements. If we can skip down to all the way down to, I'm going to get down to this slide. Slide 19, please, where we will be talking about self-direction and our waiver amendments. And we have Christy Colworth with us here. Christy, thank you for coming today and sharing information.
Thanks, Nicolette. Good morning, everybody. First off, just want to thank everybody on the call this morning. We do really appreciate our partnership with our coordinators of community services, particularly in self-directed services. And these are going to be very fun times for us all together as we operationalize this waiver amendment. So I want to talk first about the waiver amendment's requirement for self-directed service orientation. You may well know that coordinators of community services are currently required to present an overview of self-directed services to any participant that as they're entering into waiver services for the first time or considering the self-directed services model. The DDA is proposing that the self-directed services orientation process enhance that current coordinator of community services requirement. The DDA would share tools with coordinators of community service that they must use to orient participants in their teams. In this proposal, self-directed services orientation would follow these steps. The participant would alert their coordinator of community services that they are considering self-directed services. The participant would choose for the orientation to be either held virtually or in person. During the orientation, the coordinator of community services would play some videos associated with the training, answer questions using a frequently asked questions tool, share the contact information of the self-directed services lead in that participant's region so that the team may contact them with any outstanding questions, and complete an orientation checklist with the participant to show that the orientation was completed. To provide consistent information to participant and teams, the DDA would share the following tools with coordinators of community services. First, the self-directed services training videos. We're proposing that self-directed services orientation include modules 1 through 3 of the self-directed services training series. Module 1 is self-direction overview. Module 2 is the self-directed services team. And module 3 is person-centered planning. We'd also share an orientation checklist that would be completed by the participant to show that they completed the orientation, and we would share a frequently asked questions tool with answers that you all would be able to use to answer common questions. Next slide. We're proposing that that orientation checklist include the following data elements. Simply the date and time the orientation was held, and an attestation from the coordinator and the participant that shows that each module was viewed by the participant and their chosen team, that the frequently asked questions tool was used and reviewed, and that contact information for the self-directed services lead was shared with the participant and the team. By having the coordinator of community services facilitate this orientation, we're ensuring that it's accessible to all participants in the format that works best for them. The orientation checklist would then be uploaded into LTSS Maryland to document completion of the orientation for anyone who is required to have that in the way per the waiver amendment. I'll pause here for any questions, thoughts, and concerns you all might have about this orientation, the self-directed services orientation, and how we're proposing it be implemented.
Chrissy, there is no questions at this time. Thank you.
We don't see any questions?
No, ma'am.
Okay. As much feedback as we can get on this, the better we'll be.
I do see a lot of questions just
Okay, I was like, okay.
Yeah.
Just
All
can we
right.
go through some of them,
My
Nicolette?
apologies.
That's okay. They all just came in. All right. You could start at the top, Nirvana, if you'd like. And we don't need to read anyone's name.
Unfortunately, I'm not seeing it on my end. That might have been what the disconnect could have been.
Okay, no problem.
I can
I'll
take it, Nicolette. I think I have
All
it.
right. Cool. Thanks,
So
Christy.
the first question that I have is, where is the contact information located for each SDS lead? We do have that information on our website, but in this situation, we would ensure that every coordinator of community service who is doing orientation with people has that information readily available to them. We'd have functionally, I would want that to be included on the checklist very clearly. The next question I had was around feedback. When was there CCS input on this proposal? So that is exactly what we're doing right here. This is a proposal that we're seeking your input on. So I do really appreciate that question. Will the CCS be able to review the slides only, or do they need to sit through the whole videos? So if you're not familiar with the Self-Directed Services training series, it's a resource that is available to anyone, including coordinators of community services. And modules 1 through 3 are not long videos. They are anywhere between 10 and 20 minutes. So we would expect that the CCS sit with the participant and their team during those videos and offer any time for pause and breaks in between. Is the CCS required to facilitate the orientation videos 1 through 3 all in one day? That is what we are proposing, again, because the videos are not very long. And we want to make sure that people have all their information so that they understand the service delivery model clearly. Will there be training for CCSs on this orientation? That is our goal, is to have some time to be able to teach CCSs how to do this. We see this as an enhancement of the current requirement, like I mentioned. So our goal would be to for CCSs to have a structure for which to fulfill that requirement that is there. And the training videos are the ones that are currently available on the DDA website. That is correct. So, and we had a question regarding, will orientation be for newcomers only? So the waiver amendment requires any person coming in after October 6th to have this orientation. There will be a glide path for folks between October 6th and December 31st to complete the orientation before March while they're self-directing, but anyone after with a person-centered plan date after October 6th would need to complete the training. Got some great feedback on this. Thanks, everybody. DDA would provide the orientation checklist. So the tools that I shared, the videos, the orientation checklist, and the frequently asked questions document would all be deliverables from the DDA to coordinators of community service. I think I answered all the questions that I see that are not duplicative. So we can keep on moving, and if I didn't answer your question, I can answer it at the end as well. Next slide. Great, thanks so much. Updates to the Self-Directed Services Manual. Along with the waiver amendment, the Self-Directed Services Manual will be updated based on it. Reasonable and customary benefits. The Medicaid waiver program provides participants self-directing their services the option to offer benefits to employees within applicable reasonable and customary standards as established by the DDA. The reasonable and customary standards were created in the new updated manual using benefits information that was shared by DDA providers. They shared what was commonly offered they shared what was offered commonly to direct support professionals that they employ. The proposed reasonable and customary benefits charts are available in the draft of the manual that was shared with the Waiver Advisory Council. Please be sure to follow up with the Waiver Advisory Council Coordinator of Community Services representatives to share your thoughts and feedback. And I know Rhonda will have additional thoughts regarding that process and what happened there. So similarly, the Medicaid waiver requires individual and family directed goods and services to be reasonable and customary. The draft was created using data from previously submitted individual and family directed goods and services requests and market standards in Maryland. So that proposal for that chart of reasonable and customary individual and family directed goods and services is also available in the draft of the manual that was shared with the Waiver Advisory Council. Day-to-day administrative supports decision tree. The Medicaid waiver amendment requires a day-to-day administrative supports decision tree. The plan is to use a form to walk participants and their teams through the requirements of day-to-day administrative supports. This form would include a list of household and personal management tasks that are specific to the participant, which of the listed tasks the participant can do for themselves, with and without support, and which of the listed tasks the participant cannot do for themselves, including all resources that may support the participant, and a list of unmet needs after all above resources are used, identifying where day-to-day administrative supports are needed. So I'll pause here to request any questions, concerns, or thoughts regarding particularly the decision tree and what that might look like. What we've listed here are the data points we'd want to collect. And then just a notice to you all to connect with your Waiver Advisory Committee representatives. Will this information be included in the PCP? I think this is a question regarding this supports decision tree. So the decision tree would need to be completed and submitted in the person-centered plan if the participant is requesting day-to-day administrative supports. It would be how assessed need is defined and determined. These manual updates are proposed and have been shared with the Waiver Advisory Council. That is correct. But they do operationalize the waiver amendment. So if you had a day-to-day administrator, that form that needs to be completed. So our proposal is that if a participant wants to utilize day-to-day administrative supports in their plan, they would need to complete the decision tree as a deliverable to show assessed need. And the question was, what section of the plan would it need to be documented in? I would appreciate your feedback. My perspective would be within the documentation to show assessed need, where you put those documents. It would be required for every participant every year. So the question is, would the day-to-day administrative supports decision tree be required for those who currently have one? Our perspective is that assessed needs should be shown during every plan year. The team would complete the day-to-day administrative support tree, the decision tree, with their coordinator of community service and other team members. I think those are the questions that we received about that. So we can move on to one more. Thank you guys for having patience with me this morning. Next slide. The Medicaid waiver amendment requires a new reporting form for situations where a participant receives waiver services from a relative, legally responsible person, or legal guardian. The new form would be required for both service delivery models. In self-directed services, all participants must complete the family and staff form, even if they do not employ relatives. This new form would replace the family and staff form. We're working to design a form that will be accessible to complete and easy for all to understand. Our proposal is to use a Smartsheet form that requests basic data related to these provider types. The new reporting form would be similar to ones used for electronic visit verification, living caregiver exceptions, and individual and family directed goods and services requests. we would request the following data from the Smart Sheet: the LTSS ID, the name of the participant, their date of birth, their service delivery model, their person-centered plan annual plan date, whether or not relatives, legally responsible people, or legal guardians will provide any waiver services, and if a support broker is required, has the participant hired a support broker. Next slide. So those are those items that I read through that would be required on the Smart Sheet form. Next slide. There we go. If relatives, legally responsible persons, or legal guardians are planned to provide a waiver service, the following additional information would need to be uploaded into the request: a name of all the relatives, legally responsible persons, and legal guardians who will provide those waiver services, the name of the hired support broker as applicable, full-time or part-time status of each listed participant, relationship between each of the listed persons and the participant, the waiver service that will be provided by each person listed and the hours they will work, their rates of pay for each person listed by waiver service, and a list of any employee benefits that would be offered to each person listed. A copy of the Smart Sheet submission would be emailed to the Coordinator of Community Services and participant. The Coordinator of Community Services would upload that form into the participant's LTSS Maryland record. Participants self-directing their services who use relatives, legally responsible persons, or legal guardians as staff are required to have that independent support broker as per the Self-Directed Services Act of 2022. So we appreciate input on this process, design, and content of the form. Please keep in mind that this form will be across both service delivery models. You're hearing Christy talk about it, but it is for everybody. All right, question about will the Smart Sheet be in the PCP? That would be the goal, that a copy of it would be uploaded.
Hi, Christy.
Yeah.
I can take it from here. I have the questions now, if that helps.
Excellent, excellent. Thank you so much. It's very difficult to look through.
I'm sure. I got you. Hi. So, can a day-to-day admin live out of state?
So that's a question regarding the waiver amendment and the scope of the service. So I need to look that up to confirm where we landed with the waiver amendment. Unless Christelle, are you on the line and available? She might not be. I'll message her. We'll figure it out.
Sounds good. So, for the SDS or traditional, the SMART form is required.
Correct. The SMART form would be required for both service delivery models. Do we have any other questions?
Sure. Who will be considered a relative?
That's a great question. So the waiver amendment redefines relative as a parent, either adoptive or natural, step-parent, grandparent, step-grandparent, sibling, step-sibling, aunt, uncle, niece, or nephew, or spouse, or child, or stepchild. That covers them all.
Will this need to be approved prior to adding family as staff to the plan?
This is a reporting form. So the reporting form will alert us of the participant's intention to hire a family member. Keep in mind that the waiver amendment. Keep in mind the waiver amendment requires only allows for 40 hours per employee. So there's no longer an additional DDA approval for that. And so it will need to be reported before the plan is submitted and need to be included with the plan.
Great, thank you.
Mhm.
How long is the anticipated review time?
This form would be reviewed with the plan.
Is the CCS responsible for completion for a traditional and STS?
Yes,
Will this be the responsibility of employer or provider?
it is the responsibility of the team, the participant and their team, to report, regardless of whether or not the family member works as an employee, vendor, or for a provider. So it will need to be reported. So if I use the provider managed model and my sister is going to work for me directly and provide community development services to me, but she works for a DDA provider, that will need to be reported using the reporting form.
And our last question for now. The cluster of July APD dates should be considered regarding the additional administrative tasks and forms being added to PCP planning.
Thanks for letting us know that. We are operationalizing the waiver amendment and waiver amendment requirements. I had an answer on that last question regarding day-to-day administrative supports.
Mhm.
Day-to-day administrative supports employees must live in Maryland
And
by
I've got
owning or renting a place in Maryland and continuously occupying it. Some details there.
great. And I got a few more questions in. Can you clarify if aunt, uncle are considered if they are in-laws? Um, they have been receiving some feedback that they're not their biological aunt and uncle. They are married to them.
So that
What's
is,
yeah.
yeah. So aunt and uncle, if that is, if my sister marries a man, that person is my children's uncle, regardless of if it's by marriage or biological. So aunt and uncle, that terminology applies to both marriage and biological.
With this form, will this form
Yeah.
be reviewed with the providers and traditional services?
Our goal is, as we operationalize all portions of the waiver amendment, is to train all stakeholders and to share all updates with all stakeholders, including DDA providers.
What is the time frame for the SDS training? For example, in TY, can we do it earlier in the year, or does it need to be within a certain time frame to, to be considered an active training?
So I think this is a question regarding mandatory training. So mandatory self-direction orientation will be required for all participants who are entering into the service delivery model before they can begin self-directing. There will be a glide path for participants who have annual plan dates after October 6th through December 31st, where they'll have 3 additional months to complete the orientation. But after that, every single person who is interested has to do that step before they can begin self-directing. Hope that makes sense.
It does. Does day to day need to be in person or virtual or both?
Day-to-day administrative supports are really specifically scoped in the waiver so that the services need to be within that scope, and they're non-direct services, so they don't need to be provided with the person in the room.
Is there a plan to add this component to the PCP module since it's required for both service models?
I think that's a great thought. As I mentioned, our goal as a DDA is to operationalize all portions of the waiver amendment by sharing the details of the updates with all stakeholders.
Can the SDS orientation training be completed in a group setting?
So that's an interesting question. Our goal was for it to be individual, so that each person can have their own chosen team there. I don't necessarily see the benefit of having a group because participants have different learning needs, and that would not enable it to be as accessible as it could be.
And they expanded on the question later on about siblings.
I don't,
This
I don't
still
know what
applies.
that means. Yeah, I'm not
Mhm.
sure I understand that question.
What is the timeline for orientation, for example, within 90 days of the PCP plan? Can it be done prior year before they actually start SDS?
I think that's a great question. I'd be really interested to hear feedback from coordinators of community service on what would be appropriate. So the question is functionally, how much time should pass after a person does self-directed services orientation before they begin training? Can it be a year? Does it have to be 90 days? So if you have any thoughts on that, you can email me at christina.culbreth@maryland.gov. I'm happy to get that feedback from you all. The orientation is required for people who are new to self-directed services. All right. I don't want to take up much more of our time. I know we have a limited amount of it. But if you have any additional questions, we can get those at the end, or you can email me, and I'm happy to talk about anything that concern you have.
All right. All right. Great conversations. All right. Christy, thank you so much for sharing. I hope your little doggie's all right. I'm sure he misses his mommy there.
I'm so sorry. I've got a little bit of a baby greyhound, so I apologize.
Well, dogs and cats and babies make everyone smile. So I'm sure you shared some light when everyone heard them. So thank you. And again, everybody, any questions, feel free to email Christy. Um, if you put any questions here, I'll be sure to share them with her as well. Next up, next slide, we're going to be talking about waiver applications and redetermination process. Amma will be going over this with you all. Amma, if you're around, let me see. You should be able to unmute yourself.
Yes, I'm here.
All
Good
right.
morning, everyone, and happy Tuesday. I will be going over, as Nicolette said, the waiver application process as well as redetermination updates. Next slide, please. So, according to the concurrent eligibility process timeline, person-centered plans and DDA waiver application packets should be submitted within 30 to 45 business days from the date of waive placement. However, based on current reports, there are currently approximately 500 applications that are not meeting this required timeline. So this slide here is a high-level overview of the expected timeframes for the concurrent eligibility process. As you can see here, the Medicaid waiver application must be signed and submitted within 3 business days of the applicant being added to a waive. The initial person-centered plan, PCP, must be submitted within 10 business days of waive placement. And then the DDA waiver application packet must be submitted within 2 business days of the PCP being authorized or approved. Next slide, please. To streamline the waiver enrollment process, support both the regional office teams and the coordinators of community services in adhering to the timeline, as well as improve the pathway to services for DDA stakeholders, we have made the following proposal. The first will be to require that the support service planning tools to be completed annually for individuals who are on the waiting list. This tool is currently underutilized and would support the development of quality person-centered plans This will also help to inform the initial person-centered plan when someone is placed on a waive. We would also allow up to 5 business days for the Medicaid waiver application or the MA waiver application to be submitted. Combine the submission of the person-centered plan and the upload of the DDA waiver application packet documents in one step, which includes the level of care, the freedom of choice, and the EDD release form. This will allow up to 15 business days for this to occur. We will maintain 10 business days for the DDA regional office program team to complete the initial review of the PCPs. We would also maintain 2 business days for the DDA waiver packet to be submitted in LTSS Maryland, and then maintain 2 business days for the regional office eligibility team to complete the review of the DDA waiver application packet. Next slide, please. Now let's talk about the Medicaid renewals or Medicaid redetermination. Medicaid checks eligibility every 12 months, including incomes and assets. To continue receiving Medicaid and DDA waiver services, individuals must complete a renewal or redetermination process when notified. These notices may come from the Eligibility Determination Division, EDD, the local Department of Social Services, or Maryland Health Benefit Exchange. Next slide, please. The S19 code is a Medicaid coverage for individuals who are classified as a disabled adult children. The S20 Medicaid coverage is for individuals who are classified as disabled widowed beneficiaries. Redetermination notices for S19 and S20 coverage codes go directly to the participant or the recipient. They are not uploaded into LTSS Maryland. Redeterminations for S19 or S20 are due 1 year after Medicaid eligibility for these categories is first established. Next slide, please. LTSS Maryland only shows redetermination notices for cases where the Eligibility Determination Division, EDD, makes the decision. It will not show notices for S19, S20, PO7, or any other coverage group not starting with H, such as the H01 or H98, because the Eligibility Determination Division does not determine eligibility for those groups. Next slide, please. Now, the H01 Medicaid coverage is for individuals eligible due to SSI benefits. The H19 code is a transitional Medicaid that is given after H01 ends, allowing someone to keep Medicaid and waiver services while they reapply. The purpose of the H98 code is to give recipients time, which is 90 days, to submit a new application. If no application is received in 90 days, the case closes. If an application is submitted but still pending missing documents, SRT review, the H98 can stay active longer until a final decision is made. It is important to note that the H98 is a valid Medicaid coverage group. Therefore, asking to end H98 early or saying it's invalid defeats its purpose and could harm participants. Next slide, please. Redetermination notices generally are sent out 75 days before the due date. This timeline allows recipients to receive the notice, gather verifications, and submit their redeterminations either by mail or online through E&E. Please note that a copy must be uploaded into LTSS Maryland. Next slide, please. Information from the participants cannot be entered and processed until 60 days before the certification end date. Applications submitted without all required verification will be delayed while missing information is requested. Signatures are required on the application or renewal. An authorized representative becomes authorized when the applicant or recipient signs the application. This signature is their authorization. A power of attorney and legal guardians do not need the client's signature, but legal documentation must be on file. Next slide, please. Redetermination notices are generally sent. If a participant misses the due date, they have 4 months or 120 days to submit a signed renewal packet. During this time, Medicaid is not active during those 4 months. Coverage will only reopen if they are found eligible after review. If found ineligible, they must submit a new waiver application. In this case, coordinators of community services must follow the re-enrollment process. Next slide, please. How coordinators of community services can support the redetermination process. CCSs should stay informed of each person's Medicaid status and renewal cycles. They should track due dates and coverage codes and follow up proactively. Information can be found in LTSS Maryland and the eligibility verification system. CCSs can assist with submission by uploading all applications and supporting documents into LTSS Maryland. Please ensure that contact information is up to date. Contact the regional offices if you're unsure. Educate families about consequences of delay and coordinate with the regional offices as needed. Next slide, please. How coordinators of community services can support people. CCSs should encourage individuals to check their mail and emails frequently, log into MyMDThink, call the Department of Social Services at the number here, or visit in person. Just a reminder that timely action prevents disruption of services. Next slide, please. I want to talk about document submission in LTSS Maryland. LTSS Maryland is DDA's system of record. All documents must be uploaded to LTSS Maryland. The coordinator of community services no longer needs to email the eligibility determination division when submitting financial documents. Financial redetermination forms should be uploaded to redetermination application section in LTSS Maryland. Medicaid waiver application should be uploaded to the financial documents section in LTSS Maryland under client attachment. Next slide, please. Financial redetermination forms and Medicaid waiver application documents must be signed by the individual, even if there is a guardian or a rep payee. Please submit scanned documents, not pictures or screenshots. Uploading incomplete or poor quality files can cause delays. Next slide, please. I know there may be questions. Nicolette, are we doing questions after?
No, I think we could stick to the topic. So let's go back a slide. Since it's on everyone's mind today, we'll change it up. So I'm looking at the questions now.
Nicolette, you want me to take it?
Yeah, go for it.
All
Thank
right.
you.
Sure. All right. What preparations have been made in light of more frequent redeterminations for able bodied individuals to work or volunteer?
I do not have an answer for this at this time, but I will take it back and get back to you with an answer.
Thank you. Next question. Just for information, many times, especially with individuals who have SO2 or PO7MA, the readat does not generate an LTSS. Is there a better way to pull that information?
It is my understanding that that information should be in the EVS system. Participants or recipients should be getting this information as well.
What is the best system to accurately check one's redetermination date?
CCSs should have access to the EVS system that would give you the redetermination due date. We do share a report with the regional offices that have the due dates, and I believe that the regional offices do share this with CCSs. They can also find this information in LTSS Maryland.
EDD is not responding to phone and emails. In a few cases, there is no EDD caseworker listed in LTSS client summary. How is EDD held accountable? Who can who can participants and their natural support contact that hold EDD accountable outside of the regional office and EDD?
I believe all communication can be directed to the EDD supervisor, which is Patrice. You can also send us an email and we will communicate with EDD leadership as needed.
Just to clarify, we no longer should be emailing the dedicated email addresses.
Yes, LTSS Maryland is DDA system of record, so all information about financial documents and redetermination applications should be submitted in LTSS Maryland.
Does MD Think go by a different name now?
This is the most recent information that I have, but I will check on that, and if there's anything different, we will be sure to communicate.
Will time frame for EDD approving redats improve, especially when apps are submitted, uploaded on time?
We are working on enhancing our systems so that we can communicate more efficiently and streamline our process. So we are working on making sure that EDD can see what's in LTSS Maryland. So, like I said, when documents are uploaded into LTSS Maryland, that triggers an alert to EDD so that they can process it.
CCSs do not currently have access to upload the redat application section in LTSS Maryland. Will this be updated?
Yes, and I believe Nick Hugh will talk about that when he starts his presentation.
Does this info go into effect on 10/6 as well?
We will communicate when information, sorry, we will communicate that at a later time when this will go live.
On one of your slides, it stated it do not need the client's signature. Is that correct?
Only if there's a legal authorized representative, and we must have legal documents to support that.
And this is a comment. EVS does not always show the redat date. It is very sporadic. Just FYI.
Okay, we'll look into that.
Um, what is the contact or method of someone who has a change in income and wants to report it, but does not have access to MD Think?
I believe everyone is able to create an account. If you have concerns with that, please reach out to the regional office and they can support.
And that is it. Thank you so much, Ama.
Thank you. Back to you,
Actually,
Nicolette.
I do apologize. A couple of have came in.
Okay.
Um, how can we ensure MDH has the participants' rep payee's current address?
There is a process in place to update information in LTSS. I believe the CCSs should be able to input that information into LTSS Maryland. If you have challenges or concerns with that, please reach out to your regional office.
This is a concern. I'm concerned it's poor planning to stop having CCSs send EDD financial documents via email. If there's a glitch in LTSS, the CCS will have no proof of submission. A comment.
Can you repeat that one more time, Navana, please?
Sure. They stated, I'm concerned it's poor planning to stop having CCSs send EDD financial documents via email. If there's a glitch in LTSS, the CCS will have no proof of submission.
As I said, LTSS Maryland is our system of record. As of right now, we are not aware of any glitch in the system. And so we do encourage you to continue to submit things in LTSS Maryland. That's the only way that we can have a timestamp and be able to go back and refer to the time that it was uploaded.
This person is asking for clarification with slides 33 and 38. They're stating that they're conflicting. If the person supported has a legal guardian, does the person also need to sign the MA redact?
Yes, so the person and the participant must both sign unless they are the legal authorized representative as noted, legal guardian, and in that case we need supporting documents on file.
Will the eligibility group changes be public record for everyone soon if HO1 is now SSI recipients?
I believe this information is already online, but I can work with Nicolette to share with you the most updated information that we found online.
All right. And that comes to the end of our questions. Thank you so much, Ama.
Thank you.
Thanks. I appreciate it. Just a couple things to note. Um, we saw on the slide there was a little mistake. The MA application should be uploaded under the MA application category. So we will correct the slides before we release them. So we wanted to be clear here today that, again, the MA application should be uploaded under the MA application category. And then one other thing, the MD Think, as presented in July, if you want check back on the July slides, MD Think is now marylandbenefits.gov. So our presentation from July has a slide about that if you need more information as well. Any other questions, you can email Ama and myself and we'll get back to you. But just wanted to clarify a couple of those things before we go to our next slide, please. Let me check 1 second all right. So now we're going to go into those LTSS Maryland updates. We have Nick with us today who's going to give us a thorough review on these items. So Nick, thank you so much for joining us today. Really appreciate it.
No problem. Good afternoon, everybody. You able to hear me all right?
Crystal clear. Thank you.
All right, great. Let me just get my screen shared. Give me one moment. All right, you should be able to see my screen now. It's just a document I put together that talks about some of the projects related to LTSS Maryland that just went out, as well as some that are coming up in the next couple of months. So I'll just walk through these one by one. First, starting with the release that we did about a week ago on August 11th, there were a couple of projects that went out that impact the CCS group. So the first one was we introduced some new DDA-specific client attachment categories. There are technically 4 new categories, but CCS users are only being given access to 2 of them. So DDA application and DDA letters. You all will have view access to both of those, and you'll have upload access for DDA application category. We created these new DDA specific categories because we realized that DDA didn't have any dedicated client attachment categories. And so we wanted to set some up. So when you access the client attachments module now, you'll see some of these new options available to you based on your user roles. For those categories that you're able to upload to, which is the DDA application, you'll also see the ability to view the contents in the results, just like you can for any other client attachment category. We also did an update to the CCS client attachments report that you all have access to make sure that, again, you have access to search for attachments within these new specific categories that are available to you. The next item that went out in the August release, we had touched on this, I believe, during last month's, so I'll just recap this quickly. Provided a couple new updates related to the person-centered plan. So the first one, directly related to you all, is that you now have the ability to revise the most recently active PCP. So previously, LTSS Maryland was only allowing you to revise the plan if it was still in an active status. But if for some reason, let's say the plan became inactive and you're trying to get your individual back into services, rather than being forced to start from scratch and develop a whole new initial plan, you can go back and do a revision to whichever one was the most recently active one. So I've got a screenshot here. You can see this was for CP. This was a plan that was approved. It's no longer active, so you can see it in the inactive status, but you will still have the ability to revise it and set up a new plan. Another update specific to you all is, again, related to the PCP. We just put in a new business rule, and this is just a warning message that we introduced, that when you're developing and submitting a new PCP, we wanted to ensure that no one was inadvertently trying to submit a plan that would create a gap in effective dates. So for example, you can see here in my example, the person had a plan end on the 30th. I was developing a plan that starts on October 2nd, which would leave a 1-day gap. And so what we did is, if this situation occurs, when you go to submit an in-progress plan, a little warning message will pop up that says there's a gap between the last active plan and the current PCP effective date for this client. Do you wish to continue? So again, this is just aimed at trying to help guide you all as you're developing the PCPs to ensure that you're not inadvertently creating gaps in effective date ranges. So just a small update there. The next update is for the regional offices, but just going to mention it real quick. So we gave the regional offices the ability to end date services within auto-extended PCPs. So for example, if a plan goes into auto-extend and for some reason one or more of the services within that auto-extend plan needs to be cut off in order to stop the provider from billing, they no longer need to shut down the entire PCP. They'll have the ability to go in and do it at the individual service level. So you can see here, regional offices can go into an auto extend plan and set a specific end date at the service level. And if they do that, it will recalculate the authorized units. So for example, here I end dated my service early, which then zeroed out the units for all the remaining months and reprojected the cost of that service. It would also, for that reason, prevent the provider from continuing to be able to bill beyond the end date that was specified. And this is a regional office function only. All right, now moving on to our next release, which is coming up on September 8th. Couple of projects going out. So the first one, and I don't have screenshots for these yet, I do apologize, is because we haven't moved in. They're still actively under development. But the first one is a project that we identified about a month back where we needed to do some updated business logic for how we determine or classify pending applicants for our waivers. We found a couple of flaws in the existing logic that we wanted to tighten up the rules for. So that's what this project is about. To summarize, the new rule for how we identify a pending applicant for CP, FS, or CS is they have to have a DDA waiver application packet where the MA application document has been uploaded within it. So that's the trigger point that will tell LTSS Maryland, now this person is a pending applicant because we know which waiver they're applying for, and we have the existence of their MA application uploaded. So we'll be able to accurately track who our pending populations are, both for initial applicants, and we're putting in logic for reapplications. So for example, if your person gets denied and then a new DDA waiver application is created with a new MA application uploaded, that will change them from a status of denied back to pending. So we're implementing this both for initial applicants as well as reapplications. And then this next one is one that Amma was talking about just a moment ago, and I know somebody had a question about. So we did identify that the CCSs were missing access to one of the client attachment categories that's used by EDD for redetermination applications. So we are fixing that. We're giving you access to that. So we're actually doing our user acceptance testing for that. We started today, so this will go out in September. But you all as CCSs will now see that redetermination application available to you, both for searching and when you're uploading new documents, you'll have that option available to you. And if you were the user that uploaded it, you can delete it if you uploaded it by mistake or edit the program association. And we also made sure that you can search for those attachments within your CCS client attachment report. So that new category will be available for you there as well. Okay. And then moving on to our October release. So that's going to be the big one. This relates to the DDA waiver consolidation. So this one is about the move towards consolidating the DDA waivers from the 3 existing waivers down to just 1. So moving individuals from community supports and family supports over to community pathways. We are going to make sure that in doing so, there's a lot of work going into this to automatically transition to make sure this is seamless. So we're going to make sure that those individuals that do transition from community supports and family supports, they're going to keep and maintain the same level of service that they previously had. We're also going to take all the currently pending applicants for community supports and family supports and automatically convert them over to be pending applicants for community pathways on 10.6, and they will pick up exactly where they left off. So I know that's been probably a question on all of y'all's mind as CCS is the expectation here is no rework, right? So whatever they had before, we're converting them over to be at the exact same place under the community pathways waiver. So if they're already in services, we're converting them over and keeping them on those services. If you've been working with your clients to put in an application for CS and FS, and let's say you've already done an ATP questionnaire or you've already started developing the PCP, we will not make you start over. We're going to convert those over. They'll just be tagged as community pathways now instead of community supports or family supports. And then I do have some scenarios listed out here that I wanted to talk you all through because, again, I know this is a very important project and I'm sure you all have a lot of questions, but one of the big things that we're looking to accomplish that I just kind of touched on was ensuring that the PCP, the person-centered plan, is converted over correctly. So we have worked with our software vendor to go through all the different combinations and scenarios and identify, if this is what it was before the conversion, this is what we expect it to look like after the conversion. I've kind of itemized what our most common scenarios are going to be, and I'm just going to talk through those real quick with you. So the first scenario is you have an individual that has an active CS or FS PCP. So they're currently enrolled in CS or FS, they have an active PCP. What's going to happen is when we do the conversion on October 6th, their CS or FS PCP will be end dated on 10/5, and we're going to create a clone of that CS or FS PCP into an initial CP PCP with an effective date of 10/6. And like I said, it's going to contain all the same services, all the same content's going to be pulled over, and they will maintain the annual PCP date that was in their previous CS or FS PCP. We're not going to recalculate anything. They're going to stay on their same timeline. So that's the first major scenario that should address a vast majority of the conversion scenarios. Now, the second scenario is, think of this as the scenario that talks about people that are pending applicants, right? So they have a CS or FS PCP that's been approved, but it's not active yet because they didn't get enrolled before our conversion. So let's say I'll take myself, Nicholas. Nicolette is my CCS coordinator. She worked on my CS PCP, got it all the way up to the regional office. The regional office approved it, but EDD has not enrolled me yet. What will happen is on 10/6, we're going to end date that CS or FS PCP, the same thing, end date it on 10/5, clone it into a CP one, with the same content, same services, same everything, with an effective date of 10/6. It'll also maintain the same annual PCP date, but that CP PCP will also not be called active yet, right? But it will become active once EDD enrolls me in CP. So again, we're keeping me exactly where I was, just switching me over from CS or FS to CP. The plan that you already spent the time developing is still going to be there, and it'll still just be waiting on the enrollment to occur. And once the enrollment occurs, that PCP will become active. So that's really what that second scenario is. And that covers two sub scenarios under it. One where the effective date was prior to 10/6 and one where the effective date was after 10/6. But ultimately they lead to the same result, which is we will convert over the plan. We'll end date the previous CS or FS PCP to make sure that it doesn't go into effect because that program won't be in existence after 10/6. And we'll make sure that their CP PCP is in place and ready to go. The third major scenario is covering PCPs that you're actively working on, okay? So imagine, again, Nicholas is the applicant or the enrollee, and you're currently developing a PCP form for CS or FS, right? It's in progress or it's in clarification requested, any of these statuses. Again, the idea is what we're going to do is we're going to clone that into a CP PCP with the exact same content. The previous one for CS and FS that you were developing is going to be discarded. You'll still be able to view it in the client record, but there's no reason for you to work on that one anymore because we set up the CP one, and the CP one will be in the same status that your previous one was. So for example, if your CS one was in progress, your CP one will be in progress. If your CS one was already pending regional review, your CP one's already going to be pending regional review. So again, the idea is you shouldn't have to do anything beyond what you had already done. And then the fourth scenario, which is a little bit more involved, but I'll kind of walk through it again. This is a scenario where we wanted to make sure we were addressing individuals that had PCPs that overlap with another DDA PCP that might have been developed. So for example, let's say that I had or I have an approved PCP plus I had one that was in one of those intermediate statuses, like in progress or pending regional office review. What this scenario breaks down is that we're going to make sure that the approved one converts over, and then the one that was in an intermediate status, we're going to discard it because we want to, again, the idea is if a person's already in services, we want to keep them in those same level of services. So we want to make sure that we are converting their approved and active PCP. Anything else that might have been floating out there will get discarded, but again, it will be viewable and accessible to you. That way, if you need to take any of the information that you were actively working on, you can always reference it, revise the CP PCP that got converted, and add that information in via the revision process that you all already use. So that's what this final scenario is kind of just walking through. And it has different examples that talk about, what happens if the effective date of the plan was pre-10/6 versus post-10/6. But in all scenarios, again, I just want to continue to reiterate what we are focused on doing is making sure that people in services stay in those services. Their providers can still bill as of 10/6. We're just going to move them over from CS or FS to CP. And then the final thing going out alongside that in the October release is we are introducing a new service. So it's the Individual and Family Directed Goods and Services Day-to-Day Administrative Support Service. So that will be a new service that you see available specifically within PCPs for individuals that are self-directing, because this is a self-directed service. So if you identify or if you are developing a CP, self-directed PCP, this will be a new service option available. Another thing that we're doing is there's an existing client attachment category you all have access to that's called FMCS documents. We're just going to relabel that to self-direction documents. And then we're also going to make sure that we update the relevant reports so that they can reference this new service that's being introduced. And that is all I have. Happy to take any questions that there may be.
Yes, we do have some questions. So one is a suggestion. Can agencies have one login for all individuals supported to the new waiver website to do redats? Currently, each person would have to have their own email and phone number. And that was a suggestion. The question was,
Is that for, are you talking about if a particular person like staff works across multiple agencies?
well, they probably shouldn't be, but I think they work in one agency, but they want, I guess, their individuals to have like one email and one phone number. They're making a suggestion. They saying if the agencies can have one login for all individuals. So one login per agency for all the
Okay.
individuals that they support in the new waiver website to do their redats. Currently, each person would have to have their own email and phone number.
Okay. So Amma and Nicolette, that's probably something that needs to be taken offline. That's not directly related to any of these projects. That just seems just like a general suggestion that we
Yeah,
can probably take offline and discuss internally.
sounds good. And let's see.
Right. And it looks like I'm not familiar with the agency they're with. So if you would like to email us or work with the CCS, that would be helpful. Thank you. Sorry.
No worries. Will the LTSS updates be shared with CCSs? Question for you, Nick.
That's completely up to the DDA team. Nicolette, I've shared this document with you all. If you want to pass it along, you're more than welcome to.
They're stating they have a cap on upload sizes. Is this something that can be addressed?
I believe the current cap is, I want to say it's 20 megabytes, which is kind of large. There is the potential to increase that, but I think that threshold was made very specifically just to try to, control the capacity of the system. Um, but that is something that we could potentially look into.
Not sure if this is your area, but I'm going to throw the rest of these questions out there for anyone to answer. Alma, Christy, Nicolette. um, with the transition of everyone to the CP waiver, has there been any exploration to fast track pending plans with EDD?
I can take that. So we are working. Oh, go ahead, Rhonda.
You go ahead, Alma.
We have a team that is working together to process all the applications so that we don't have anyone in limbo. So we are working to make sure that we have everybody situated and nobody left behind.
And I would just add to that we would ask for your support too, as individuals will be in various stages when we do the consolidation. So the more we're able to get the application submitted, the PCP submitted, et cetera, will help versus it being in a pending status. So we'll continue to work with our Medicaid partners to support the efforts for things to be processed as many as possible before the consolidation, and appreciate your support also in the work that you do.
Thank you. The ATP ODF is being done automatically, just for confirmation. The ATP ODF is being done automatically after the new initials CP PCP are created. Is that correct?
Those are,
Nick,
I'm trying to follow the question because those are two independent things. So we don't have, I mean, Rhonda, unless you know, we definitely have automation for the ODF, but for the ATP connecting to the PCP, I'm not familiar with anything like that.
Thank you. When will the day-to-day service go live?
October 6th.
So just to clarify that too, right? So day-to-day administrative supports are currently under individual and family directed goods and services and are paid through cost savings. If a participant has that service being paid through cost savings in their plan after October 6th, there will be a glide path. And at the end of their plan, they would need to request that new service through the detailed service authorization and use the day-to-day administrative supports decision tree when they're new at the point of their new plan, or if they're requesting it for the first time.
yeah, and to add a little bit to what Christy's saying. So on October 6th, when you create a PCP, the day-to-day administrative support will show up as a new drop-down option. Similar to the staff recruitment and training, it will show up on the service authorization page of the person-centered plan. So you can add that for people who newly would like to receive it. And again, the limit would be up to 10 hours.
All right, I
Thank
think we
you.
have time for one more question as Rhonda has a few updates, and we have about 34 minutes left.
Great. And the last question, will the process for IFDGS stay the same for requesting?
So it's a good question. So it depends on what you mean. So individual and family directed goods and services exist in three parts. So the first is training and advertising and recruitment. That's within the detailed service authorization and would continue to be requested in there. Day-to-day administrative supports, which currently is paid through cost savings, but then will become a service in the detailed service authorization to be requested. And the final is other applicable and allowable goods and services. Right now, and continuing, that would be requested using the goods and service request form.
And Christy, we're making some updates to that form that we'll be sharing as part of the operationing of the amendment, right?
Exactly. To be within the scope of the service. However, the form would still exist and that request would still go that way.
All right, just circling back, it looks like there was one question for Nick specifically that I want to touch. Just to clarify, Nick, the ATP ODF is being done automatically after the new initial CP PCP are created. Is that correct?
So the only that's what I was trying to say. The automation we have is around the overall decision form. So the ATP questionnaire and the overall decision form are two independent things. The overall decision form automation is based on decisions being taken by EDD out of their E&E system. Has nothing to do with the PCP. So I'm not sure if there's other logic in place that is supposed to automatically generate ATPs based on PCP decisions. I would need the DDA to speak to that.
All righty.
That's not something we've touched in recent times.
Okay. All right. Well, thank you so much. Thorough update. I did just return yesterday. I'll have to take a look at these releases. And as everybody asked, we'll look into releasing them since It's wonderful information. But again, this will be posted, so you always have it here and explaining it too in the interim. So Nick, thank you so much for your time. We are going to circle back up the agenda to slide 12, where Rhonda is going to be going over some of the DDA-operated Medicaid waiver amendment updates. Rhonda, thank you.
Thank you, Nicolette. Really appreciate it. Sorry for joining you late. I had a conflict, but really excited about being able to join you today and share some updates related to the DDA operated Medicaid waiver amendment status. So as noted on this slide, we received public comment from various individuals, families, participants, and providers. We got a mixture of comments. We had people in support of some of our amendment proposals. We had people all suggesting alternative suggestions to what we initially proposed. And then we also had some people that were respectively opposing and did not agree with what our proposals were. We received several recommendations that were different from our initial proposals, for which will require additional stakeholder engagements and discussions. And so for those recommendations, we did not include them into the waiver proposal submission, when we will use those to inform future amendments. So really appreciate you if you had the opportunity to review our proposals and submit recommendations. Next slide, please. So this slide includes some of the proposals removed from the amendment for further discussions with stakeholders. We previously shared this in July, even before we had submitted our waiver proposal to CMS. But that included the removal of awake and alert overnight staff language, removal of the support broker and day-to-day administrative support 40 hours per week limit across all people they support, and removal of the exclusion of day trips for transportation services and respite care services. The DDA, as I mentioned, initially shared this, that we would be removing them during our July 2nd DDA amendment stakeholder webinar engagement. Next slide, please. Some additional proposals that were removed before submission to CMS includes the removal of the list of meaningful day training requirements. We do note that direct support professionals must satisfactorily complete required orientation and training designated by the DDA, which is currently noted in policy stat. We also removed the proposal to authorize services up to 6 months while a nursing care plan is being developed. So in several sections related to some of the meaningful day and the residential services, we noted that DDA may approve 1-to-1, 2-to-1, enhanced rate overnight supports up to 6 months while a nursing care plan and behavior support plan was being developed. We removed the proposal to authorize those enhanced supports while a nursing care plan is being developed. And this is because delegated tasks cannot be provided without the nursing care plan per the Code of Maryland Regulations 102711, which refers to delegation of nursing functions. The DDA may authorize dedicated supports for people new to services or participants in services who have a specific documented behavioral need for up to 6 months while a behavior support plan gets authorized. And we also noted in the waiver that the DDA may authorize nursing support services in an emergency revised plan for participants in services who have a specific documented health and safety need to support that development of the nursing care plan and subsequent requests for dedicated supports. So what that means, if an individual has health-related concerns that may need 1-to-1, 2-to-1, enhanced rate, or overnight supports, we will only be able to authorize emergency nursing support services So then that nursing care plan could be developed before direct support professional services can be provided. We also removed the proposal for emergency or unplanned departures related to overtime request form process. The proposal related to the use of legally responsible persons, legal guardians, and relatives as paid staff to exceed the current 40-hour service limit. So what this means is we will maintain a 40-hour service limit for these types of paid providers. Next slide, please. Some additional updates in the waiver submission to CMS includes a substitute judgment form will be used when legally responsible persons, legal guardians, and relatives have decision-making authority. Our initial proposal was to use a supported decision-making agreement. We received various suggestions supporting the use of supported decision-making agreements with the person-centered plan. We received suggestions to use some of our existing forms, the participant agreement, rights and responsibility, or family of staff form. And what we have done is we have reached out to the Waiver Advisory Council recommendation work group and had some conversations with them seeking input on their suggestions on how we could operationalize a substitute judgment form. Next slide, please. And some additional proposal updates included adding language related to housing support services, that the services included both direct and indirect supports, and adding the virtual support delivery model option. We've also added that first aid must include a hands-on and in-person component. Currently, we had noted that that was required for CPR, but that also is required for first aid, so we added that. And then we added emergency medical technicians, or EMT certifications, as an alternative for the first aid and CPR training requirements. Next slide, please. So public comment also included proposals that can be further explored. And so here are some examples. We had suggestions related to adding an independent scoring mechanism and validated tools to authorize dedicated hours. We had recommendations for expanding Medicaid provider enrollment requirements, recommendations for the creation of a behavioral support plan template, recommendations on the development of a provider code of conduct, recommendations for the development of aging and future planning strategies, and recommendations related to the development of strategies to share the quality improvement organization's information with participants and families. Next slide, please. So in alignment with the submission to the Centers for Medicare and Medicaid Services, the DDA has posted track change documents and a public comment summary document on the dedicated amendment webpage. Changes made after the initial proposal are highlighted in yellow. Please note, for some of the documents, there were no changes made, but we've uploaded a version so that you'll know what was submitted. And again, the things that were changed will be highlighted in yellow. Our next steps is the Center for Medicare and Medicaid Services review and any questions. We are working on information and training for all stakeholders and recently had a meeting with the CCS Community of Practice related to it. And again, our amendment effective date is noted for October 6, 2025. We've included a link on this page to the dedicated amendment page for your review. And that's the update related to the waiver amendment.
Thank you so much. I don't see any questions at this time. However, I do want to circle up to slide 10, where we're going to be talking about the services and supports planning tool. where we'll be having a little discussion. So I apologize for the back and forth today. But Rhonda, if you want to take it from here, please go ahead.
Sure, absolutely. So one of the things that we were looking to enhance in terms of the waiver application process, we know that when we put somebody on a waive, that sometimes developing that initial person-centered plan, our data is reflecting some delays in that. And so we have been talking internally, and the services and supports planning tool was a tool that was developed pre-pandemic, and it was a tool that CCSs were to create for people on the waiting list. We know that there are CCSs that are continue to use the tool and develop that for waiting lists, and then some agencies that have stopped using the tool and uploading that into LTSS. We feel the use of this tool will help to support that development of that initial person-centered plan when someone gets put on the wave. And so we wanted to open up a discussion about the supports and service planning tool in terms of what's working and what may need to be updated.
That's wonderful. Yeah. So I appreciate all of this, especially as I've been out. It sounds like, oh, that is not a question. So if anybody has any feedback, we want to hear from you now. What's working, what needs to be updated, and let's talk about it. Please feel free to raise your hand, put it in the chat box, but preferably let's talk about it. So I have a question. It says, how often should the services and supports planning tool be completed? What we have, it would be completed while they're on the wait list, right? And it helps with that monitoring and follow-up as well, right? So you're looking and identifying, right, what are the services and supports that they need. I recommend adding functional levels or level of support needed or something like that so that the new CCS can see if the individual has big changes. All right, so Caitlin, oh, sorry, I didn't mean to say your name. One of the recommendations is adding functional levels or level of support needed or something like that. I assume on the form is what they're saying so that the new CCS can see if they have big changes. That's interesting. So like if there is a new CCS assigned, let's say, you could use that tool as that guidance of kind of transitioning, getting to know the person again as they're moving forward and helping them. Also putting it in the monitoring and follow up, right? Sounds like because of, you can't see the activity notes of another previous agency even. You could use this tool as that guidance as well, like a robust kind of plan, if you will. Is that correct, how you're seeing that? They don't know the waitlist clients well, and they have more turnover in assigned CCSs, right? So it can help determine the level of support the individual needs should they get a chance to apply for the waiver. That's interesting, yeah. I mean, also thinking about that comprehensive assessment too, utilizing that and incorporating it as you're getting to know the person, wondering if that's looked at too. I think everybody, if you want to unmute yourselves, it's easier, just so we could talk. So there's a lot of questions about when to do it in certain scenarios, it sounds like, right? What's not working, maybe clarifying the timeline. If there's a previous CCS and a new CCS comes, do they complete it as well? Sounds like TY individuals and families need more preparation to talk about the future. I have encountered many who are hopeless thinking for their child and they won't amount to anything. They often use picture charts or word banks to help them describe aspirations and services need. That's good. They use the comp assessment. Right. And even just services and supports planning tool, right, is uh, created off of the Charting the Life course. And you could use any of those tools too, right? Picture charts is great. So it sounds like a lot of planning tools in general could even help you build the services and supports planning. So using the comp. But it sounds like they need more time to talk about the future. The tool is not a part of quality measures. There's a recommendation that the tool should follow more of the PCP flow and questions. It does help structure PCPs and services. Sounds like that's working. Some other recommendations is having a checkbox if someone has SSI and medical assistance. It's a great recommendation. Some find it's not user-friendly, and it should match the summary of the PCP and focus area to discuss with the person. Right, and the FAE is part of that planning as well. These are great feedback. Oh, I didn't see her. Oh, okay. Thank you, Amari. Thank you. Okay. How do I unmute?
Hello, good morning. Can everyone hear me?
Yes, we hear you. Thank you.
Hi, thank you so much. First off, thank you for this in-depth training. It answers so many of my questions, so thank you for that. But concerning the SSP tool, I think there might have been other people who might have brought up the scenario. Um, but I was recently transferred a few cases and just going through their client attachments, I realized that maybe one or two of them completed the SSP tool in June of 2025, and I was transferred the cases in July of 2025. And so I still completed the SSP tool just to get, just to see like if any circumstances have changed or if the parents or the individual themselves wanted to update any services. But in terms of like, I've also had a client who expressed that they thought the process was rather like tedious or a bit like frustrating because they felt like they were being asked the same questions and administered like the SSP tool too often. in like a short time frame. So is there, and this was like on one of my initial visits. So is there like another set of questions or something else that I can go over with the family just so it doesn't feel like repetitive for them, or it doesn't feel like they're not really getting any help while they're on the waiting list?
Thank you. Yeah, that's great feedback, first of all, right? And I think that there are an array of other types of planning tools. There is the charting the life course planning tools. There's an array. Um, they should be on, I could get back to you on where they are. I'm not sure. You could even check out the website Charting the Life Course, and they have a whole bunch of tools, and there's different types of tools, right? So there's a trajectory where they could talk about the now and where you want to go, and it's a visual. You could have buckets, right? All of the resources, different types of things that you're looking into, what's important to them, um, you know, and just to give you those as a few examples. So it really depends. You could feel out your person, talk to them, and kind of gauge, put that paper down, use it just as that kind of prompt. But I think really having conversations and being open with them just up front is the best way at first. Then you could use that page as that prompt, not just reading from it. Um, I hope that helps, and make that connection in that way. Um, and then using it, again, as kind of the conversation piece, using it for your note taking. If there was something that you missed, you could have that conversation the next time. The FAE and the PCP someone brought up, those are those 5 points that makes a meaningful life, right? Talking about, hey, what is it that you're interested in the community? What is it that you always wanted? So making it more of that conversation while using those prompts and using it as a tool to fill out, I would say is the best, right? Kind of human interaction that you could do, and not just really use it as a piece of paper to fill out. So I hope that helps overall. Um, and it's overall good feedback for us too, as we want to, if as we're going to revise this, to meet what you need. But I think it all comes down to keeping that human aspect behind it, right? In conversation, and not looking at it as that requirement, but rather a support tool to help guide meaningful conversations to really get out what is it that that person's really looking for in a meaningful life. And then from there, help them get those services and supports. So we only have 8 minutes left. We did want to open up one more topic from everybody. It is, now we're going to go back down the slides to right at the bottom where it talks about CCS trainings. Let me pull it up. Slide 41. And I'm just going to go ahead and ask before we are looking into, and please raise your hand, I'll do a better job at trying to, I know where to look now and how to do it. So we want to hear from you about training and training from DDA and what you're doing, right, during onboarding and your orientation. And if you had 3 training areas of interest, what are those things? What are those trainings that you would like? What are those needs and priorities? Um, and what's working in what you're doing or what we're doing or what's not working. So I'll leave it from there. And again, I feel like we could talk about this. We only have 7 minutes, but please, raise your hand if you have any feedback. top 3 training areas that you're looking, what would be best? Great feedback here on that. I'm looking. So if you could have top 3 training areas of interest, let's start there. What would that be? It looks like we have PCP, monitoring, and all waivers. So the autism waiver, the Medicaid application waiver, Medicaid application. So a little bit of everything. How to find community resources for those on a wait list. Self-direction. Forensic. Report pooling and utilization. Technical reviews of step-by-step processes, like how to actually complete the waivers or complete the PCP, actually complete a monitoring form. So actual visuals, it sounds like, would work better. More walkthroughs. It sounds like one agency has a 16-week orientation, and it's a combination of the DDA webinars, hands-on with supervisors, shadowing teammates. Understanding services thoroughly, DDA and non-DDA. Working through LTSS, troubleshooting, especially with the PCP. When to complete a MFP referral and qualification. They like what's working is the HRC module, and having a PCP one would be super helpful. Process mapping and step-by-step for Medicaid redetermination process. The Medicaid coverage groups and redebts. Here's a different one. Communication, collaboration, and crisis management. Still going down the list. Okay. Person-centered planning, self-direction, and utilizing the EVS system. All right. And what's onboarding, training, and orientation looking like on your end? So we see one agency has a 14 week, and it goes from, webinars, understanding services, and then basically shadowing, which is great, yeah. We have a 2-week orientation. More information would like to be known about the state review team and EID. Waivers in TY, self-direction, community supports services. CCS shadowing, really helpful to learn from one another. What wasn't working is there was a 3-month period where they only shadowed 2 people, but within that same time frame, they also had other people shadow them. Sounds like that was not working out. In-depth PCP training would be great, monitoring waiver application and HRST and others. All right. Keep them coming in. So we do have 1 minute left. I appreciate it. I wish, I want to hear more. Please feel free to email me with more ideas and, what's working, what's not, right? I think it's great to hear from all of you and you're hearing what everybody else is saying. So let it, sit with this, really think about what are those top 3 training areas. I really like how you're going through, all right, we have the conceptual, the philosophical aspects, right? But how do you physically do it? Then the in-person orientation, shadowing, right? Again, that's visual, that's hands-on. It sounds like that would work well. A lot of LTSS, PCP, EDD, eligibility, and then resources and related activities is what it sounds like generally. Okay. Well, thank you, everybody. Yes, please email me. I appreciate it. Thank you. We went through a lot of the questions today. Please feel free to email us accordingly. If you're not sure or don't have anybody's email address, you could always look on the DDA website for contact information. There's a dedicated CCS, partnering with CCS page that has resources and our CCS leads contact information. I will put that in the chat for everybody to have, and my email as well. But because it is 12:01 and I want to respect all of your time, thank you so much for joining today, and continue bringing in your ideas and thoughts. Send them over. The service supports planning tool, the trainings, all of that's going to be really helpful hearing from you, and we will continue this conversation and collaboration. Any other questions that we didn't address, we'll look through the list and get back to you, all right? But thank you so much for your time. We appreciate all of the work that you do. We can't stress that enough, truly, truly, truly. And we want to help you with what you need. So please keep them coming through, these recommendations. Love it. All right. Have a good day, everybody. Make sure to eat lunch. It's 12 o'clock. Take care. Bye-bye.